My name is Sarah Maxwell, and I'm the Director of Marketing at ThriveAP. At ThriveAP, we are honored to have an expansive faculty of expert speakers and advanced practice providers with impressive credentials and experience. Today, I'm going to take a few moments to get to know one of our speakers a little bit better and gain some of their advice for thriving in an advanced practice career. So thank you and welcome, Angie Golding.
Well, thank you so much for having me. I mean, this is very nice that you guys do this.
Oh gosh, we're honored to have you as part of our amazing team. So I would love to take this opportunity just to do that, get to know you a little bit better. And I'd love if you could tell us, just a little bit about yourself, your background, who you are, where you're from. Tell us a little bit about your practice.
So right now I live in Arizona and northern Arizona. So we have a bit of snow on the ground, but I own two practices as a nurse practitioner. So as a nurse, I spent 20 years as a flight nurse in helicopters and fixed wings and various critical care types of things. But as a nurse practitioner, I've worked emergency departments, urgent care, did some hospitalist work, and then really have concentrated on that primary care, even through all of that. So I own NP from Home, which is in Munns Park, Arizona, where I live. Small community, and I only see the people who live in this community. And then I also have NP Obesity Treatment Clinic, which is in Flagstaff, Arizona. And as the name implies, that clinic is to treat the chronic disease of obesity.
Wow, that is not a resume you often hear. Flight experience specifically. I think that's the first time I've heard that.
Okay.
So tell us a little bit about, with such an illustrious career, what brought you to ThriveAP? What interested you in kind of working with our team?
I think I met some of your administrators when I was the president of the American Association of Nurse Practitioners. And they told me about the program, and not a lot of programs are teaching about obesity. And so I asked if there would be any interest, and this was quite a while ago, in doing something to bring obesity for that first year or two when people are first out in practice. And then I was so excited because the approach to me was not to just do one small talk, but we did a whole workshop. And we've done it more than once now. So I really appreciated the opportunity to reach so many advanced practice providers, NPs and PAs, who are coming into practice early on after graduating, and being able to really explain and have the time to really explain what obesity is as a chronic disease and why it's so critical that everybody in primary care, women's health, pediatrics, pretty much anybody that's doing any kind of primary care is aware of what obesity is. So it's been an incredible opportunity for me to be able to get that information to a group that's really working to be as successful as they can possibly be by being in a program like you all are offering.
Absolutely. And I mean, gosh, talking about chronic disease, I mean, that's something that it just becomes more and more prevalent every single year. I mean, especially now, I feel like obesity is such an epidemic that's constantly on the news.
Yes, COVID certainly brought it to the forefront on the news, that's for sure, because it became one of the primary comorbidities that made COVID worse for people. But I think for me, the passion that I have for the chronic disease of obesity is, first of all, I'm a woman who lives with obesity. It's a disease my father had, other family members have, and it's just not well understood as a chronic disease. People still look at us and think we just don't have enough willpower. And I can pretty much say I finished a doctoral degree in 11 months. I think I understand what it takes to have willpower. But yeah. I just so appreciate that ThriveAP is making this available to the participants in your program, because it's just 70% of America has pre-obesity or obesity, and obesity causes 236 other diseases. So it's such a delight to see a program like this willing to put this into their curriculum, and in such a large way. not just, oh, come to an hour presentation, but a whole workshop. And so I can't thank you all enough for doing that.
Well, thank you for providing your expertise and your knowledge to, the future of advanced practice. I think that's what's super important to us at ThriveAP is supporting APPs, helping them thrive both in and out of practice. So working with people like you who have this amazing knowledge and depth of expertise is what helps us do that. So thank you. And kind of with that, I think this might go into this a little bit, but tell me a little bit about what's your greatest passion in your role?
So I think for me, it's twofold. Having had the privilege of serving as the president of the American Association of Nurse Practitioners, one of my greatest passions is to continue to move forward the role of the nurse practitioner and to make sure that that role is well appreciated and is at the table in all of these situations where there are multidisciplines at the table. And so I continue to be loud and proud about that. I guess I can say I'm pretty passionate about that. And then, of course, from a personal place where I'm treating patients, the opportunity to help people who have faced so much bias and stigma, even in the healthcare environment with the chronic disease of obesity, it's really one of the most incredible experiences I've ever had as an NP, to be on that journey with those patients and to be able to provide them with a safe, unbiased, non-stigmatizing environment has really been a privilege and something that I just am so passionate about. And I was talking to someone earlier today. They said, well, would you be willing to travel here to talk? And I'm like, if you tell me I can talk about obesity, I will travel anywhere.
I love it. Well, and I mean, help you escape the snow, right?
That too. Although I think where I'm going has more snow, so I'm not sure that's going to be helpful.
Oh, no.
But yeah, but I think that those two passions go well together right now. A lot of the things that I'm doing are bringing the nurse practitioner to the table in multidiscipline places around obesity. So it still is just one more place that I can put the two passions together.
I love it. Well, and you mentioned that you're a past president. Are there any other noteworthy career accomplishments that, you love to pinpoint, or just, what would those be, and why were those so notable to you?
So I probably will say I was asked this as in a fellows interview for AANP. And I think having been on the board and being the president-elect and then the president, as we moved through the process of having two national NP organizations and merging them into one, probably will remain one of the greatest highlights, because I think it helped nurse practitioners. My PA colleagues always had only one organization that was the largest organization they have with AAPA, but we had two, and it caused some confusion and it caused some separation of the efforts that we could put forward in health policy and in just so many different areas. So the opportunity to be part of something that was that large, to bring those two organizations to form one, I think made such an impact and helped us be at more tables, helped us move the profession forward, as our AAPA colleagues had been doing for years with just their single organization.
Absolutely. I mean, I think that provides such a great opportunity for the camaraderie too, right? It's such an expansive community of so many knowledgeable folks that, hey, if there's an opportunity to get everybody together and really align, I mean, that's just invaluable.
It is. It absolutely is.
Well, and speaking a little bit about supporting, fellow APPs, what do you think are attributes that make a good mentor?
First and foremost, someone who loves what they're doing. I think if the person who's mentoring someone else isn't in a practice that they love being in, isn't still enjoying patient care, it's hard for them to help the next generation come in and have the same enthusiasm. So if I was looking for a mentor, I'd want that person to still have that enthusiasm, but also to be able to help me with roadblocks that show up. Someone who has had some stumbling areas in their career so that they can help me understand how to move through those kinds of things. But I also think a mentor is someone who can help set boundaries too, because sometimes a mentee begins to depend so much that they're not doing their own critical thinking. So I think it's important for a mentor to say, those are great questions. Where would you look to find the answers? And if a mentor's not pushing you to do that, then I think they're not giving you what you're going to need to make your own way. And then to be able to turn around and be a mentor yourself. So I think that those are things that I would look for in a mentor.
Yeah, basically giving them the tools to be proactive and take that initiative. I think that's a really good point. And it actually kind of led into my next question, funnily enough. As somebody like you who's teaching, who's giving workshops, who's giving presentations, what journals or resources do you use to kind of keep you up to date, to make sure you know what the latest and greatest procedure or best practices or new trends are that might be emerging in the space?
So I think that's difficult because part of it depends on what space you're in. So from a general perspective, for my PA colleagues, I would say the JAAPA, the Journal from the American Academy of Physician Associates, would certainly be, and the same for the NPs, the JAANP and then JNP, the two journals from the organization. I think those give a broad overview of what's happening across multiple disciplines. I think where your mentor can help tremendously is when you're getting into subspecialties. So for instance, in my world of obesity, we've got 5 or 6 main journals, but we have every Friday an organization that does an overview of everything that's been published in the past week about obesity. And so I coded that, and then I looked to see what do I want to pull from the different journals. If you're specializing in endocrinology, especially diabetes, you've got the ADA's journal. So I think when people start to get into subspecialties, then they have to look outside our organizations and go to those multidisciplinary. And I mentioned the ADA on purpose because our physician colleagues have subspecialty organizations that are very large and have journals. And they're excellent. But I think sometimes for us, because we are so grounded in education for our patients, we don't get that from those journals, but we do from the interdisciplinary journals where dietitians, nutritionists, exercise physiologists are also providing information into that journal. So I think it's important when you're getting interested in a specific disease process that you look for an interdisciplinary journal so that you get more than just medicine's view.
It's kind of that, beyond evidence-based. It's that, what else is out there and to make the holistic provider, right?
Right. And it's the evidence-based from other professions besides medicine. So it's the evidence-based from the nutrition scientist, from the physical activity scientist, the exercise physiologist. So, or physical therapy. So we're still very much in evidence-based, but we're broadening to other disciplines who are doing the research to bring into our practice as well. And I think that's why those interdisciplinary journals and organizations are just incredibly valuable.
Absolutely. And then lastly, because I want to be respectful of your time, What advice would you give for APPs of today to help them prepare for a successful future?
So one thing I would tell them is to be proud of what they are. So try not to let themselves be labeled by a broader label. So APPs is a broader label, but it makes the NP and the PA invisible because it groups them. So be proud of the fact that you're a nurse practitioner, you're a physician associate, and make sure that people utilize what your hard-earned label certification is. That's one of the first things, because I think that, we work so hard to not be mid-level, right? But there are still groups that try to continue to still hide us, make us invisible. And I mean, the DEA is certainly one by still making us mid-level. But I think that being proud of our label, I'm proud to be a nurse practitioner. My goddaughter is proud to be a physician associate. But the other advice I would give them is, if you find that the practice you're in, you don't get the time to see your patients the way you want to, you don't find joy in how you're being able to care for your patients, look for a different practice. Don't stay somewhere where A, you're underappreciated, B, you're not allowed to function to the fullest extent of your education, and C, you don't have joy in what you're doing. Because there are plenty of physicians out there. And it may mean that you have to look a little bit more, but I would really encourage everyone that those three things are critical to a long-term successful, because you can find mentors outside of where you work, like your program. I mean, it's a perfect example of an amazing program that helps people find what they need to go from being a graduate to being a successful provider. But I think that those three things make for a lifetime career. And it can change as you go along too. That's one of the greatest advantages we have. We don't have to go back to school if we want to change from orthopedics to family practice. We have such a luxury with that. And I would just encourage everybody to keep their eyes open.
Well, I think that's incredibly sound and wonderful advice. And I mean, I think it, coming from you who is very clearly very passionate about what you do and helping your patients and, bringing light to this chronic morbidity, I think we could all do well with following some of your advice.
I have one more thing that I would really like to recommend to people. And I think this is hard when they get out of school because they've got student debt and stuff. But your national organizations are working so hard to bring good education to you as part of your membership, and also representing you on the Hill, trying to get rid of those barriers. So even if you don't want to be politically active, I would say to a new NP or PA, pay your dues so that there are people who can be politically active for you, and get rid of these stupid Medicare laws that prevent us from doing things, like ordering diabetic shoes. I mean, there's just some really stupid things in there. And, utilize some of your funds to let your national organizations work for you.
I think it kind of goes back to the point of being an active member of your community in whatever form it takes, right?
Yep, absolutely.
It's so empowering about the advanced practice community is it is so expansive, and when y'all get together, powerful things happen.
Yes, exactly.
Well, with that, I want to thank you for your time today, and thank you for sharing your incredible expertise and your advice. I know there are so many people out there that will really benefit from learning more from you. And And I know your time is very valuable. So I'm very grateful that you joined us today.
Sarah, thank you so much for inviting me to this interview. I really appreciate it.
Oh, it is ThriveAP's honor, I promise.
Okay.
Thank you everybody for joining us today, and stay tuned to meet more of our faculty, and have a great day.